One of the toughest things in life is dealing with the end of life, and it's a very difficult situation. It's a very difficult subject to talk about, and communicating what good hospice is all about can be a very daunting task. Here to talk to us today about hospice is Margaret Welsh. She is the community relations representative for Good Sherpherd Hospice. Margaret, thanks for coming on.
Thank you for having me.
Now, Good Sherpherd Hospice has been on the show before, and they do a terrific work. Why don't you just tell our viewers a little bit about what Good Sherpherd Hospice is and what they do for the community?
Well, we've been serving the community since 1979, so we are the longest standing hospice in this area. We offer end-of-life services for people who are, say, in the last 6 months or so of their life. It could be any diagnosis whatsoever. So many people think that hospice is strictly for cancer, but it can cover any diagnosis: heart disease, lung disease, Parkinson's, Huntington's, any type of end-stage diagnosis. We're there to support people in their journey as they go from this world to the next, and we do that through a variety of services that we offer.
Now, dealing with end of life, it's difficult. It's difficult for people, and an organization like Good Sherpherd Hospice, who has been there and has the experience dealing with this type of situation, it's a huge bonus for the families to have a service that's available like you guys.
Right, absolutely. And I can speak about that personally because I've had experience with Good Sherpherd Hospice with 2 of my family members. So beside the fact that I've worked here for almost 11 years, I've also experienced it on a personal level within my own family and been able to see what I talk about all the time.
Right. Now, the Good Sherpherd Hospice has a lot of different types of services that they make available. One of the things that is interesting is that you guys are starting a new type of outreach. Can you tell us a little bit about this?
Well, that would be my role. It's called community relations, and like you said earlier, families do oftentimes have a difficult time talking about death and dying. So what our executive director has done is he's created this position of community relations representative, and our goal is to get out into the community and talk to people, communicate with them before they actually need the services, if you will. So we're trying to discuss not only death and dying, but all of the things surrounding that, just aging in general. You know, in this country, Steve, people don't want to talk about aging, and they fight it tooth and nail, and they don't want to talk about death and dying. So I've created a list of presentations that we can take out into the community to talk about and then broach the subject of hospice within those presentations.
I think it's a really great idea. You know, it seems like any of the subjects that are difficult, whether it's illness or whether it's just end of life in general, you know, whether you're talking to children or you're talking to the elderly, it can be very difficult. Having a game plan and knowing how to address these situations is key.
It is. It's really tough. And I have a friend right now, for example, whose mother's been diagnosed with a malignant tumor, a very large one, and needs to have surgery. And the mother herself does not want to talk about it. She thinks the doctor's wrong. She doesn't want to deal with it, doesn't want to discuss it, and the daughter's very frustrated and doesn't know what to do. And a lot of that is denial.
Right.
So we have to help her figure out some way to approach this subject in a way that would be comfortable to the mother and help her to deal with the reality of it. Sometimes, Steve, it just takes time for people, the truth, to sink into people. And that's, you know, what we try to help with too.
I would imagine that a lot of it comes from maybe, I mean, fear in a lot of cases, but what is the role that education actually plays? I mean, yeah, you're talking about, you know, going through some of this, but to actually educate people and help them understand what their loved one is going through or whatever. I mean, what role does that actually play in helping people cope?
Huge, huge role. one of the things that I want to do in this role in community relations, and it's not just going to be me, we're going to have the company in general, we're going to partner together to try to reach out into the community, is to discuss some of these subjects that are difficult for people. And if we can do that in such a way that it's not uncomfortable for them or it's in a safe surrounding, that makes it all the better. And people are open up and feel more at ease to talk about these types of subjects. So that's where we're going with that.
Mm-hmm. Now, Polk County obviously is a big retirement area. People from all over the country move down here to spend, you know, the rest of their life, their retirement, their you know, their end of days here, and I would imagine that's probably a huge need for hospice. What is the capacity that Good Shepherd Hospice has? I mean, as far as, you know, being available for all these elderly?
Well, let's put it this way. If you look at the number of patients we serve on a daily basis, it's about the same amount of patients that could fill Lakeland Regional Hospital.
Wow.
So we are taking care of many, many patients every day, not only in Polk County, but in Highlands and Hardee counties as well. And since we have been here since 1979, we have a huge amount of resources and staff available, and highly trained staff, I might add, too. Our social workers have master's degrees. Our chaplains have master's degrees. And we have nurse practitioners and physicians that are available as well. So we're fully equipped to do it, and if we need more people, we'll just hire them.
Well, and you mentioned, you know, you have all these, you have a terrific reputation. I don't think I've ever heard anything bad about Good Shepherd Hospice. How does somebody go about scheduling a presentation like this? I mean, do they just get in touch? How do they get in touch?
Sure, they can call our office in Lakeland, which is 682-0027, or they can call me. I have a direct line, 559-9207. I go to civic organizations, clubs, service groups, 55 and older communities. I did a presentation at Kiwanis last week and another one at a Chamber of Commerce luncheon event. So it's really just available to anyone. We do health fairs, community fairs, those type of things, anywhere where we can get some exposure and let people know what our services are. Many people, Steve, have no idea that these services are all covered under Medicare and Medicaid, or private insurance oftentimes has hospice riders to it. And we work with TRICARE, which is the military insurance. And one thing we do as well is we don't turn anyone away for a lack of ability to pay. Last year alone, we did around $1.5 million in unreimbursed care that we offer to the community. So the big thing is if someone has a question, all they need to do is call us. We can always send a nurse out and have an information visit if you want to, no pressure. And then we can pursue it from there, let them know what our services are on a one-on-one basis. Or like I said, they can always call and just have a conversation with someone if that's less threatening to them, and we can go into detail about all the things that we offer.
Now, Margaret, are you currently the only one doing the presentations, or do you have other folks that that are being assigned presentations as well?
Well, I'm the official, if you will, community relations representative, but we do have other people internally, like from our bereavement department, that go out and do presentations. Our chaplains will do it as well. We're trying to develop a speakers bureau right now. Well, I shouldn't say we're trying to. We have developed a speakers bureau, and
so even if you're already booked for the day,
absolutely,
you'll be able to fill that spot
absolutely,
and have somebody come out.
Absolutely.
Terrific.
And if it comes through me, I can always disperse it to the correct people as well. We're out there for the community, not only to serve them at end of life, but through some of these presentations to educate them and inform them. In the medical world, there's a term called informed consent. Well, my personal goal is people can't make an informed consent if they don't have all the information. So what we want to do is get out there and give them the information that they need. And it may be about hospice care, which is of course what I'm going to talk about, but I also have a presentation called Community Resources for Our Aging Population. Well, there's an assortment of resources out in the community aside from Good Shepherd Hospice that I can point people to in the event they need that. So it's not always presentations about death and dying per se. We're out there to try to serve the community in a variety of capacities.
Yeah, that's terrific. And I'm looking at some of these presentations that you give, and it really is a whole list. The sandwich generation, caught in between. That sounds like it would just be a really engaging presentation. Have it your way. Advanced directives, aging population, positive aging, caregivers cope, end of life issues and veterans, volunteer opportunities. I mean, the list just goes on and on. There's tons of different subjects that it looks like you're going out and presenting on.
We can, absolutely. I have to say, you mentioned the sandwich generation. That's one of my favorites because many people in their 40s and 50s and even in their 60s, they are indeed sandwiched between aging parents that are maybe declining and they have a family of their own that they're trying to care for. So they're kind of sandwiched in between there, trying to take care of the aging parents and take care of their own family, and they're torn in different directions. So what are the resources out there for them? And where can I point them, and how could we possibly help them when the time is right for their parents to access hospice?
And I think that really highlights the fact that hospice is not just about the services to the aging family member. It's really the service to the entire family.
Thank you. Thank you. That's exactly right. And that's what our team of professionals do when they go into a home. They're not only caring for the patient, which is, of course, the utmost importance, and we're going to do that clinically through our nurses and physicians and nurse practitioners, and we have hospice aides that'll come out and do bathing. We have social workers that can maybe pull some of these community resources together or address those real emotional issues, and our chaplains to deal with spiritual issues. So we're going to address all the issues of someone and their loved one, because if the person is passing away, they are obviously very concerned for their loved one that they're leaving behind. And so we want them to feel assured that we're going to take care of them as well. And in fact, we stay, through our bereavement department, we stay in touch with a family for up to a year after the loved one passes away. We offer counseling one-on-one or grief support groups. We call them on the phone. We send them information in the mail. And there was actually a study done nationwide that said that surviving spouses of hospice patients tend to live longer than spouses who did not have loved ones on hospice. So it's obvious that the support is needed and definitely beneficial.
Absolutely. Margaret, this has been great. You know, this seems like it's such a good direction for Good Shepherd Hospice to go and to reach out and inform and educate people about all these different issues.
I love it. And I'm actually born and raised here in Polk County, have lived here most of my life, so the community is very familiar to me, and I have to say they're very warm and open and welcoming these types of things, even though it's a difficult subject to talk about. You know, it's something that's being received well. So I look forward to continuing to do this. And if anyone has any interest at all in having either myself or someone else from our organization come out and do a presentation, they can always contact me. I can email them a list of the presentations. They can take a pick from one of them, and we'll set it up.
Terrific. That's the Good Shepherd Hospice, their community relations division, just starting up. And it's such a great resource for your church group or your club or whatever it might be to be educated. It might be your neighbor, it might be your best friend that has a family member that is at end of life, and this is a terrific opportunity for you to educate yourself and learn about how to cope with these things. Now, Good Shepherd Hospice has been around for a very long time, and there's nobody that does this better than them. They truly are a beacon in this community when it comes to end of life and hospice care. To get a hold of them, to schedule a presentation, it's really easy. Just give them a call. You can call Margaret Welsh at 863-559 9207. They've got their website. It's really easy to get to. The easiest way is just to Google Good Shepherd Hospice, and that'll get you right to their parent website, Chapters Health. And you know, this is a great opportunity. Go ahead and get involved and use this resource that they're providing.